what Act Now does, might have seen in TV and papers. I don't know why Murthy, being a journalist, started this, but his intentions are very clear. He wanted to propagate some things in life. He wanted to give to people who have given him back and what he has earned from the public. The services which he have started are something very difficult to do. Being a non-medical person, meeting so many doctors, asking them to come for the awards and giving them awards, recognizing their potential. You see, these things are so difficult to garner. Along with his brother Rajshekar and his brother's wife, all these three together have built up Act Now. We are only namesake directors or I'm a vice chairman. I thank you for remembering it, making me remember it. Okay. But this somehow started after COVID. During the COVID period, there was a lot of things which doctors had to do without their own personal agenda. And many of us lost their lives. More than 3,000 plus doctors and around 4,000 and odd co-workers like the sisters, paramedical staff and all those people, all through India. We were recognized, it was very fine. But all of a sudden, once again the value of doctor came down to only minting money. I don't understand why people take it in this term. It is not always that we are after money. Money is also necessary for us. At one time when my father was a surgeon, they used to say it is a noble profession. Things were very different then. Now we also have a family to feed. My children also want to have a BMW or a Mercedes Benz or something, a building in high scale area like Kondapur or Banjara Hills. Nobody is interested in staying at Ashok Nagar in Old City nowadays. The scene has come to that. And why not earn? My contention is, whenever I go to many politicians, they say hospital bills are more. I tell him, why does the patient go to a hospital when he cannot afford? Why does he want to go and blame a hospital when his bill is more? You want 5-star services, you want AC on 24 hours, you want a sister standing beside you even if you cough, sneeze, talk or do something. You want the doctor to be standing beside you. We are there to give you treatment, not to cajole your 5-star capabilities. At home you might not even have a bed sheet to put, but in the hospital, some people who go to the government hospital also do that. They feel as if they are lords. A patient must always behave like a patient. That is my contention. You have problems, everywhere there is a problem. Problems can be solved, can be sorted out with mutual administration, with mutual talk and mutual things. That doesn't mean that for every damn thing you blame the medical community every time. We are getting blamed because we are silent. I welcome our chairman. Chairman sir, Ajay Mishra ji, to the dais, please, with some good claps. He is also a very good philanthropist. Murthy knows whom to make chairman, vice chairman and directors. It is his talent. That's something inherent. Okay. We were talking about the relationship between the doctor and the community. With the advent of so many hospitals, with the advent of corporatization, you cannot expect that the bills will be less. You cannot expect things will go that easy. We have to cope up with all these things. My simple request, we cannot tell the patient and their attenders what to do, but we can tell our doctors what to do. There is a lot of infighting amongst us. There is a lot of negativity which is spread by our own colleagues amongst us. My simple request today, if you don't mend ways, the right to health bill which has come in Rajasthan will come your way in Telangana also, all over India. What is right to health? They are saying that you go to any hospital, say that it is an emergency. The child talking there is an emergency to the parent. That is not a medical emergency, but people won't understand that. They will say, my stomach ache is an emergency for me, I will go. You have to treat them, give them the disease quotient, give them the medicines, and if it is not possible, make the arrangement for an ambulance to take them to a better center. Who will force the bill? How will we pay salaries, the rents, the electricity, and everything to our staff and our people who are working under us? So politicians don't understand all these things. They understand popular vote bank. I request our doctors, join together. You become a vote bank. They will come to your knees. Why are they so positive towards quacks? I will not even say RMP. We are RMPs. We are registered medical practitioners. They are not RMPs. Don't tell them RMPs. They are quacks. They don't have a degree. They work under you as whatever, because we have less paramedical staff in the districts, in the villages, in nursing homes. People from villages come and work as compounders, whatever you call them. And they learn, they see your prescription, they learn what is the doctor giving, what is the treatment given for this pain abdomen, what for this cough, what for this allergy. And they go to their villages and start their clinic. Until that point it was fine. Now they are demanding commissions. They are coming to big hospitals. I don't know, some corporate hospitals started this. I don't think now it is running. Even small hospitals also. I will take an example of Suryapet, a small town in Algonda, a district by itself now. Today, a quacks meeting was been organized and there are around 50 to 80 nursing homes who are supporting that meeting. You want to sell yourself, man. You are a qualified degree holder. You want to sell your shame. You want to sell yourself in the market. You want to beg down to a people who don't even have a degree to get you patients. You don't have the capacity to do that. Why you have to pay commissions to anybody? You are a qualified person, studied on your own. Getting a medical college seat is so difficult, you know. Even if you have studied in a private medical college, your parents have paid for it. They have earned that through sweat, soil and everything. Why do you want to bend down? My request to all the doctors, don't give any commission. The moment you stop, everything will stop. Quacks will vanish. If you start giving commissions, it is my request to all the corporate sectors also. You don't give them parties. You don't do anything. If they want to get a case treated, let them come and get it treated. That doesn't mean they will pay 30%, 40%. I heard in some districts 40, 50% is the amount of fee paid to the quack. It is so shameful. As doctors, as qualified persons, we are not supposed to do all these things. You don't need any medical council norms or National Medical Commission norms. Think in your heart what you are doing. If you feel that it is correct, do it. But if it is not correct, don't encourage any commission system. Neither you give, neither you take. A needy person, if he comes to me, a CT scan, I know 2,000, 2,500, 3,000, MRI 5,000, everybody is getting. But if you can reduce the same fee of that person, then that makes a greater impact on yourself, on the person's attitude, and he will always bless you. You have to gain respect. Earlier, our seniors used to gain respect. Now we are begging for respect. That is not the way our life is to go. If your child doesn't respect, hey, my father, he takes commission from this hospital, he takes commission from this lab. What is the value of your life? It becomes literally zero. I use these platforms to inform everybody, you can stand up on your own. You can build your empire on your own. You can grow your practice on your own. Your dedication, your work, your attitude will definitely see you rising very high. My request to everybody, please stick to regular trends. Ethics are very important in practice. Do practice them. Then once again you will be honored in much better platform. Murthy is doing it here as a non-doctor. No doctor honors another doctor. I have also seen this. I don't know the reason why. This enmity has to go. This negativity has to go. We have to stand together, and together if we stand, no politician, no bureaucrat, nobody will come and give us a direction what to do. You be clear, everything will be fine. I thank Murthy for asking me to come as a chief guest. It has not been once, many times, but it is really homecoming. I feel this is my home. Sundays normally I don't travel outside, I don't go except for IMA meetings. But Murthy garu cheppin tarvata sometimes I don't come, but many times I do come. Thanks Murthy, thanks Rajshekhar, and thanks everybody for coming here. Sunday is a good time, but this is something which you have to do in your life to see that our doctor community rises much above whatever is there today. In 10 years, I want to see our doctor community go in a much higher platform so that we gain respect through our work, through our attitude, and the profession stands very high. Thank you very much.
Well, addressing a gathering in a different note. So many valuable things. Being a common man, if I could feel honored, I don't know how you felt. Give a big hand to our Vice Chairman and learned Dr. Shri Sanjeev Singh Yadav Garu. I